Hello there, Taylor. How are you today?
I'm good.
Awesome. Okay, so for your last appointment, I gave you a 5-day food diary that you kindly did fill out. As I reviewed it, I made some recommendations for you from Canada's Food Guide because you are at a high risk for caries.
I'm sorry, I know that you explained the whole caries process before, but I just don't understand why I'm at a high risk for caries.
Okay, well, great question. You're at a high risk because of some of the foods that you do eat that are listed here. Cariogenic, meaning causing of tooth decay. Foods like yogurt with granola, yogurt and honey, any fermented carbs. So the fermented carbs, including sugars and starches, contribute to the dental caries formation. So as you can see here, the starches are broken down into sugars in your mouth by saliva. These acids lower the pH of plaque. The longer the pH actually remains on the tooth, the more likely the enamel erosion will occur.
Okay, so basically a cavity just forms from the acid being on the teeth because of sugar. Well, how am I supposed to prevent a cavity from happening? Do I have to totally cut out sugar from my diet? Because I don't think I could do that.
No, you don't have to. But as I told you in your case presentation, you're at a high risk for caries related to frequent snacking and a broken tooth related to poor diet and nutrition. So what I have done is actually circled all of your food in your diary that have put you at a greater risk for caries. So what I've done is made recommendations from the Canada's Food Guide to benefit your daily life.
Okay, I think I'm ready to change my diet and eat more balanced meals and less sugar. I really want to reduce my risk for cavities because I hate the feeling of local anesthetic in my mouth.
Exactly. So firstly, as your dental hygienist, I encourage you to brush after meals, floss regularly, and have regular checkups every 6 months. When brushing is not possible, even a rinse is fine. A mouth rinse is very beneficial. But for your frequent snacking, I even suggest drinking 8 cups of water daily because you could be thirsty instead of hungry. But if you're still hungry, try to have already cut up fruit in the fridge, but make sure you rinse after because fruit does have sugar in it. For Canada's Food Guide, I believe you're just not getting enough protein from the meat and alternatives on Canada's Food Guide. A great source of these would be tofu, chicken, kidney beans, and even eggs. For your meat and alternatives, you need 2 to 3 servings, at least a handful on your plate. This will make you fuller, so you do not snack often. For grains and vegetables, your serving was higher, but by eating more fruits and vegetables, it will benefit your diet.
Okay, so I've heard before that I need to eat more meat in my diet. I guess that would be good for my mouth because meat doesn't contain sugar, and also it'll make me feel full, so I don't want to snack on sugary things.
Okay, exactly. So for milk and alternatives, milk is very cariogenic, but we do need calcium for our bones and our teeth. So by incorporating 3 to 4 servings of milk, soya products, yogurt, and cheese, it will make us healthier individual and give us the nutrients to make our brain to function. Lastly, for our fruits and vegetables, we do need 7 servings a day. So I believe even having half the daily servings of vitamins, so by incorporating at least 2 vegetables into your meals, at least 1 snack during the day. Meals with salads have many vegetables like tomatoes, cucumbers, mushrooms, zucchini, and even avocados will benefit the day. And these have great fat sources as well, which will fuel your brain.
Okay, great. I definitely think I'm ready to change my diet and eat a lot less sugar and also brush and floss because I really want to bring down my risk for getting a cavity.
That's great. So do you have any questions for me today?
No, I think that's everything.
Okay, great. Thank you.